Back here in Accra, another non-governmental organization, Basic Needs for the mental health sector, has debunked claims that people with mental disabilities are immune from COVID-19. Now, according to Project Officer for Basic Needs, Sunday Anaba, government must be concerned about many of them roaming freely on the street in this time of the infection. Ghana Federation of Disability and hundreds of vulnerable people in Accra were beneficiaries of relief items from CSO platform on sustainable development goals. PSA Nanaya Osafo has more.
As the toll of global pandemic continues to rise, worst hit remain the poor and vulnerable, as well as many people with disability who barely have the means to compete economically. For many people with disability who already suffer labor discrimination and massive unemployment, the times have taken a darker turn. Many go to bed without the satisfaction of a single meal in a day.
We present it to you in the name of God the Father, the Son, and the Holy Spirit. Amen. Amen.
The Ghana Civil Society platform on sustainable development goals gave over 200 bags of rice, gallons of oil, soap, sachet water, and vitamin C capsules to persons deemed vulnerable in the society. 20% of items were earmarked for the aged and widows, 15% for the mentally challenged, 25% for persons with disabilities, and 40% for street children. Some members on the platform include the Ghana Anti-Corruption Coalition, Send Ghana, and the Star Ghana Foundation. Co-chair of the CSOs behind the initiative, Joyce Lanyo, said the reason for the move was to try to bridge the gap between the rich and poor that may be worsened by the global pandemic and to help government live up to the task.
The civil society platform and its partners in the wake of the COVID-19 national emergency established this fund to complement and support the varied efforts being executed by the government of Ghana. The response fund is intended to coordinate in a concerted manner the efforts of actions of all civil society organizations, networks, associations, and to leverage on the strength we have in our numbers to impactfully address some of the inequality challenges that the COVID-19 pandemic may create in the spirit of leaving no one behind.
The Ghana Blind Union received items on behalf of the Ghana Disability Federation. Other beneficiaries given food for distribution were the Gamashi Development Committee in Jamestown, Aid Aged Foundation in Kaswa, and a few selected outfits in the Ashanti region. Executive Director of the Ghana Blind Union, Dr. Peter Obiya Samoa, called for special distribution methods of national relief packages for the disabled, as many are being left behind.
We need to have more of this support coming from government side, okay, for our members, because look, the initial distributions like that, many of our members didn't benefit from these things, because we are most of the time indoors and we are not getting the information. If you just lump us on to persons with vulnerable when you are distributing things, it's likely that in most cases blind people would not be able to access that kind of support. Economic stimulus packages and things. You'd also remember that there are persons with disability who also need to benefit from these economic stimulus packages.
Project Officer of Basic Needs, an NGO for mental health and development, Sunday Anaba, agreed that the situation was same for the mentally challenged.
With this COVID-19 response, and that is why we come in, and that is the difficulties we are experiencing, there have been support to people in the communities who are termed as vulnerable. But when you also get to the communities, among the vulnerable, there are people who are even more vulnerable. And so when the support gets to the community, some people get it, but the people who are even more vulnerable are not able to get this access. I am here, I work with our volunteers, I work with our self-help group chairpersons and then chairmen, and they give us reports that yes, they have brought support to their communities, but they are not able to access it.
He debunked the supposed immunity of the mentally challenged from COVID-19 and called on district assemblies to take streetism among the sick more seriously.
There has not been any study that has been published to say that people with mental illness are exempted from getting COVID-19. So they being on the street, which they are still on the street, it's also just a point that we need to look at. That even when all of us are inside, and there are still people outside who can easily contract the diseases, and one way or the other can give it to us. So as a government, what do we need to do? The Mental Health Act that was passed in 2012 also looks at paying attention to people with mental illness, and it puts the responsibility of people with mental illness wherever they are under the district assemblies. So this is the time that the district assembly will have to also look at the Mental Health Act and see what they can do. If they have to provide temporary accommodation for them within this period and provide them some feeding for the period, so that they can even provide, it will even be a basis in which they can even get them treatment. They can get them a psychiatrist to be reviewing them for some time. Then they will also protect them from getting the diseases.
PSA Nanaya Osafo, Joy News.